Welcome to this month's edition of Focus on Health. I'm your host, Dr. Barbara Brookmeyer, and today we'll be talking about addiction. It's preventable and it's treatable. And our special guest is Sarah Drennan, Clinical Manager for the Behavioral Health Services Programs at the Frederick County Health Department. Sarah, welcome. Thank you for joining us.
Thank you.
Let's jump right in. Is addiction a disease?
It is a disease. It's a chronic brain disease that affects both the way the brain is structured and the way it functions. And there's really no one factor that can determine if someone will be affected by the disease of addiction. It's really a complex tangle of factors that can include genetics, a person's environment, as well as the age at their first use. And age at first use can be particularly important because of the way our brains develop. The prefrontal cortex, which is located right behind our foreheads, is actually the last part of the brain to develop. And that is where our complex decision-making happens, our judgment happens, and it's not until about age 25 that that is fully developed. So that may explain why teens are especially prone to risk-taking behaviors, which can include drug abuse.
So is addiction preventable?
It is, and that's key. That there are effective, proven strategies to prevent the onset of substance use. If a child makes it to age 18 without using substances, the odds that they'll ever start are dramatically decreased. So there are programs out there, for instance at the health department, like Kids Like Us, which is a program that the health department provides in schools for grades 4 through 8 for some children who are especially at high risk. And then they can flow right into the Adolescent Clubhouse, which is in Frederick, called On the Mark, and that provides a safe and fun environment during after-school hours for teens to have a sober peer group.
So since kids or teens are particularly vulnerable, what are some things that parents really need to know?
Well, that it is preventable and that prevention can start in the home very early in childhood. Just by talking to their very young children and continuing those conversations as their children grow. There's some great online resources that are guides for parents to have those age-appropriate conversations, starting when children are really young, when you're giving them medication when they're sick, or a daily vitamin, and growing up through those teen years. And it's important for parents to remember that what they say does matter, that kids listen to them, even teenagers do pay attention to what their parents say, more than they pay attention to media, more than they pay attention to their friends. That's a huge factor in determining whether a child will stay drug-free or not. A child who grows up in a home where there is talk about the risks of drug use, they're up to 50% less likely to use drugs.
Wow. That is some, as they might say, some sobering statistics. So what else should parents maybe be doing?
Well, those conversations that they have with their child can be an exchange of information. So I know parents want to stay in the know about these substances and the lingo that changes rapidly. So it can really be an exchange. They might find out, for instance, from their kids that Molly is actually the name of a new substance that's similar to ecstasy. They might find out that farming or farm parties actually refers to pharmaceuticals very often nowadays. Pharmaceutical use or prescription medication use is on the rise with young people. It's actually the most commonly abused substance for 12 and 13-year-olds. And those kids who abuse prescription medications are getting it from their family house or their friends. So it's really important for parents to know to lock away their prescription medicines, to dispose of them when they're finished using them. And there's actually several permanent medication drop-off sites at local police stations around Frederick County now.
Well, so we've talked about prevention of drug abuse and addiction. So let's talk a little bit before we end about treatment. Is addiction treatable?
Absolutely. Addiction is very treatable. And that's most effective, according to research, when behavioral therapies are combined with medication, when that's appropriate, and that the therapy takes into account co-occurring medical and psychiatric and social problems that that individual may have. So it's really individually tailored to fit for that person. And we expect some measure of relapse. just as other chronic illnesses like diabetes or heart disease. There is some relapse there, and it doesn't mean that treatment has failed. It means that treatment may need to be reinstated, it may need to be adjusted to find that better fit for the individual so that they can establish an ongoing sober lifestyle.
Mm-hmm. Well, thank you. You've provided really good information. So first, that addiction is preventable, but then when there is a concern or knowledge of there being addiction present, that it is treatable, and people just need to stick with it and keep trying, and there is hope for the future, and you provided really good resources for folks. So I hope that some people will take a look at those resources and learn more about what they can do to prevent and also get somebody into treatment early.
Good, thank you.
Thank you for joining us. And now please stay tuned for this month's Medical Myth.
Frederick County Office of Highway Operations is ready to maintain clear passage on all roads during snow and inclement weather incidences. Take extra precautions when driving near school bus stops. Stay at least 2 car lengths behind a snow plow and never cut between a caravan of plows clearing the highway. Residents should shove their driveway aprons to the right, facing the street, so the plows will not throw the snow back into their apron. For more information on winter storm safety, contact the Office of Highway Operations at 301-600-1564 or visit www.frederickcountymd.gov/snow.
Ever wonder whether something is recyclable or not? Or maybe you forgot to set your cart out at the curb. Now there's an app for that. Download the free My Waste app for tablets and smartphones to have convenient access to a wide range of recycling and disposal information. Be notified of upcoming events, see your recycling schedule and set customized reminders, as well as instantly report curbside problems. Find out more at frederickcountymd.gov/mywaste.
With school back in full swing, the Frederick County Sheriff's Office is offering citizens a few tips to ensure the safety of Frederick County students. Hi, I'm Corporal Jennifer Bailey. School is back in session and school buses are traversing our roadways. Motorists should slow down and be especially alert in neighborhoods and school zones. They should take extra time to watch for children at intersections and near the roadway as they wait at bus stops for morning pickups and afternoon drop-offs. Maryland law requires drivers to come to a complete stop when the lights on a school bus are flashing, and they must stop in both directions if there is no physical divider or barrier. Remaining completely stopped will help to ensure the safety of students. For children who walk to school, parents are encouraged to make sure their child's path to and from school is a safe route. Wearing bright or light-colored clothing will make children more visible to drivers, and placing emergency contact information inside a backpack can help law enforcement to identify a child quickly if they are lost or injured. All citizens should report suspicious activity or reckless driving immediately. By working together, we can ensure the continued safety of students this coming school year.
Frederick County Workforce Services and its partners are proud to support Frederick Works, one job at a time, an employer hiring initiative that encourages Frederick County businesses to create or fill at least one new job to boost our local economy. So far, the initiative has tracked over 1,500 jobs. There's no cost for employers to participate, and the benefits of joining include positive community recognition and free publicity. Visit www.frederickworks.com/onejob for more information.
And now here's this month's Medical Myths. This month's medical myths are about suicide from SAVE, the Suicide Awareness Voices of Education. A common myth that is false is that people who talk about suicide don't really do it. Almost everyone who commits suicide gave some clue or warning. Don't ignore suicide threats. A second myth that is false is that anyone who attempts or commits suicide must be crazy. Most suicidal people are not psychotic or insane. Many are experiencing extreme emotional pain or are grief-stricken. A third myth that is false is that if a person is determined to kill him or herself, there is nothing you can do to stop them. Even the most severely depressed person has mixed feelings about death, wavering until the very last moment. Many do not want death. They want to stop the pain. The last myth that is false is that talking about suicide may give someone the idea. The opposite is true. Bringing up the topic of suicide and discussing it openly is one of the most helpful things you can do. For more information about talking to a person who may be thinking about suicide, please check out the brochure available at the Frederick County Health Department buildings and website. That's this month's Medical Myths. And now here's Angie Blair with this month's health tip.
Hello, this is Angie Blair, health educator with the Frederick County Health Department. This month's health tip is brought to you by the Communicable Disease and Preparedness Program of the Community Health Services Division. It's flu season, and the single most effective way to avoid getting the flu is to get a flu vaccination each year. Cases of flu are generally the highest during the months of January and February, so it's not too late to get vaccinated. Flu vaccination is recommended for all people 6 months of age and older. It's especially important for young children, pregnant women, the elderly, and those with health conditions that affect their body's ability to fight off infections. By getting a flu vaccination, you are also helping to protect those who cannot get a flu vaccine, such as infants less than 6 months of age. There are two types of flu vaccinations, the injectable, generally called the flu shot, and the intranasal. Both are effective. Adults 18 years of age and older should contact their health care provider or visit one of the many community locations to get a flu vaccine, such as pharmacies and grocery stores. The health department does not have flu vaccine available for adults. Children can get a flu vaccination from their health care provider and, depending upon the child's age, at a community location. The health department had flu vaccinations for children in October and November. To check if the health department will host additional flu vaccination clinics, visit frederickcountymd.gov/flu or call the health department's flu information line at 301-600-3035. Flu vaccine is available at the health department free of charge for children 6 months through 17 years of age while supplies last. In addition to a flu vaccine, the following are excellent ways to prevent spreading or coming into contact with germs, such as those that cause the flu. Avoid touching high-touch surfaces such as doorknobs, telephones, keyboards, etc. Avoid touching your eyes, mouth, and nose. Wash your hands frequently with soap and running water. If soap is not available, use a hand sanitizer. Practice good cough etiquette by coughing or sneezing into your tissue or use your sleeve. Remember to properly discard of the tissue and wash your hands. Avoid contact with someone who is sick, and if you are sick, stay home. Don't go to school, work, or do other activities. Get enough sleep, exercise, and nutritious foods daily. For additional information about influenza and seasonal flu vaccination, visit frederickcountymd.gov/flu or cdc.gov/flu or call 301-600-3035. Thank you for tuning in to this month's Health Tip.
And thank you for joining us for this month's edition of Focus on Health. Please join us next month.